Upper cross syndrome is the combination of forward head posture and rounded shoulders. And today I'll be going over part 1 of my brand new treatment for upper cross syndrome. If you're new here, then welcome. My name's Adam, and on this channel you're going to learn brand new strategies for relieving your pain, fixing your posture, and increasing your strength. Now if you're someone who has upper cross syndrome and has already tried to fix it and failed, let me know in the comment section what you've already tried so I can give you brand new content. And of course, don't forget to hit that like and subscribe button. Now let's get into it. Like I said earlier, upper cross syndrome is a combination of forward head posture and rounded shoulders. And this can lead to things like weakness, balance issues, and even different kind of pains like TOS, which is thoracic outlet syndrome, bicep tendonitis, headaches, and more. Now to treat upper cross syndrome, the best way to do that is to actually look at the body from the side. So while looking at the side view, you can clearly see we have some upper cross syndrome with the forward head posture and the rounded shoulders. And to first understand what's going on here, we're going to be drawing two lines like the ones you can see there. Now the first one that's being highlighted is going to represent the shortened active muscles. These are the muscles that we tend to use on a daily basis, and because of that, they are constantly contracted, they get stronger, and then they end up shortening. So the muscles at the end of the line right now that's being highlighted, those muscles are your stronger and tighter muscles that are shortened. Now the main function of muscles is to move bones around joints, and when you have upper cross syndrome, you basically have the head getting pulled forward on the spine, basically creating that bad posture. So those short muscles are ending up pulling that muscle or pulling the joints forward, making it look bad and creating that bad posture basically. But now we can draw that second line, which actually crosses the first one, and this line represents the weaker muscles that become elongated thanks to that posture getting pulled. You see, whenever the posture gets pulled in one direction, the other muscles that are attached to it go along with it. And in this case, those muscles become stretched out and lengthened and weakened. And if you think about stretching after the gym, what's the idea of that? Is to relax the nervous system, relax the muscles. Well, that's what's happening to these muscles right now. So not only do you have the shortened active muscles, you also have the weakened muscles. And when you connect them, you get that cross, giving you upper cross syndrome. Now, if you want to learn more about these muscles and their relationships between the short and lengthened muscles, check out the video in the top right corner. Now, it's important to understand this because different therapists are going to be doing different things here. You have some therapists that are going to try to train the weaker muscles. You have other therapists that are going to try to alter those joints. And then you have other therapists that try to open up those tightened muscles. But I'm going to tell you right now, none of these are correct by themselves. And that is why this new treatment is going to be incorporating all three therapies, with part 1 being releasing those short muscles using self-massage techniques. Now there are 5 muscles you're going to be targeting for the self-massage portion. That's going to be the occipitals, the sternocleidomastoid, the scalenes, the pec major, and the subscapularis. And the idea here is to perform these self-massage techniques on these muscles for about 2 minutes each. And with 5 different muscles and 2 muscles each, you're looking at a total of 20 minutes of self-massage. Now, I know that sounds like a lot, but I can almost guarantee that you're going to need to do this multiple times a week for the next few weeks before you even move on to treatment number 2 and get those other results. So with all that said, let's get into the techniques. And the first muscle we're going to be working on is the occipitals, and the first thing we want to do here is locate the muscle, which is right behind the head, beneath the skull, right next to the spine. And these muscles become shortened and overactive because they're helping our head look up when we have that forward head posture. Now before performing self-massage on this muscle, we're going to perform a quick self-assessment. This is to make sure that we're not going to pass out during this treatment because there is a nerve that runs right behind it, even though it is unlikely we're going to hit it. So all you're going to do here is simply look up and then all the way to the back as if trying to look at something behind you, and hold that position for 30 seconds. And then from here, you're going to reset and then look over the other way. If you begin to feel any dizziness or anything abnormal basically during the 30 seconds, then make sure to stop, come back to a reset, and maybe go talk to your doctor and talk to them about that specific situation. All right, let's get on the techniques. Now there are two techniques we can do here for the occipitals, with the first one being static pressure. The idea here is to look in that little area, find the most tender spot, hold on to it for a minute, and then you can move on to the next technique. Just make sure you're not on any spine or bones. Now from here, we can also move on to micro movement. Very similar static pressure, find those tender spots, but from there, you're simply gonna be moving up and down or side to side on that area, almost as if you're trying to level out that little tenderness, that tender area. Or you can also think of it as trying to hit the edges of that tender spot as well. Once again, do this for another minute and then switch sides for a total of 4 minutes. Now next up is the sternocleidomastoid, also known as the SCM. And this is gonna be one of the 2 neck muscles we're gonna be targeting that helps people with their forward head posture, or creates it basically. And the first thing you wanna do is locate this muscle. And it's very easy to find. All you have to do is look to the opposite side in order to make the muscle pop right out. Now there are several techniques we can do here, again starting with static pressure. We can find the most tender spot within the entire muscle, starting from the clavicle all the way to the ear, and all you're doing is looking for the most tender spot, going to pin that muscle and then hold that tenderness for about 30 seconds, or hold that area for 30 seconds. Now from here, you can move on to stripping, where you're simply taking your fingers or whatever tool you have, starting at the edge of the muscle and then moving up and down the muscle. Again, do this for 30 seconds. And now from here, we're gonna do another similar technique to stripping. All we're gonna do here is simply grab the muscle and we're gonna peel it back towards the back of the head, going up the muscle or down, whichever direction you're going. And again, you still wanna do this for another 30 seconds. And then finally, what we can do here is a pin and stretch. Simply rotate your head to the opposite side, grab that muscle now, and then rotate your head to the same side in order to stretch it out. You can even look up to get a smaller stretch in there. Again, do this on the different areas, on the different spots that are tender for another 30 seconds, totaling 2 minutes. Again, you have 2 muscles here, both sides. Do it for both sides now. Next up is the scalenes, and this muscle is the second neck muscle that we're gonna be targeting that creates forward head posture, and it's a big player with people who have thoracic outlet syndrome. Now these muscles are located basically right behind the scalenes, just go right behind it, and it's going to form basically a triangle going up to the ear and down into the clavicle shoulder area. So here you're gonna perform 30 seconds for each of these techniques. The first one being static pressure. Again, find the most tender spot within the muscle and then hold that tender spot until that pain goes away. From here, you can move on to stripping. We're gonna just go from the bottom and then move our fingers up the muscle and then down it in order to help open that muscle out. Again, do that for 30 seconds. Quick tip for that one as well, if you need to, you can use a towel or something to place between your fingers and the skin in order to get a better gliding surface. Now from here, we're actually gonna perform a similar technique like stripping. We're just gonna go towards the back now, peeling the muscles again. Basically starting from the front of it and then going straight towards the back, going all the way up the muscle and down it. Again, do that one for 30 seconds. And finally, we can do a pin and stretch. All we're gonna be simply doing here is moving our head to the same side, pinning that muscle down with our fingers, and then tilting our head to the opposite side as far as we can, allowing that muscle to strip and stretch underneath our fingers. So now we're moving on to the pec major, which contributes to rounded shoulders. And the idea of working this is we want to start into the sternum and then work our way out into the shoulder. Now, if you have breast tissue, then you want to get as close as you can to that sternum while still maintaining pressure on the muscle and not the fat tissue. So get as close as you can, as far as you can, while maintaining pressure on the muscle. I think you know we're going to start here. That's right, a slow roll. Gotcha. All you're gonna do here is start at the sternum and then slowly move your tool or your hand all the way across the chest into the shoulder. We're gonna do that for 30 seconds. So while performing your slow roll, make sure to look for the most tender spot within the muscle, because now you're gonna go on that tender spot and perform static pressure for another 30 seconds. The next technique we can do here is micro movement. What we want to do here is simply stay on that tender spot, but now move around it, trying to flatten again and trying to hit the edges of that area. Again, do this for 30 seconds. And the final technique we can do here is a pin and stretch. Again, pin the most tender area and then take the arm through its full ranges of motion, trying to open up and strip that muscle away. Do that for another 30 seconds. Don't forget both sides. The final muscle here is the subscapularis, and this is a rotator cuff muscle whose main job is to internally rotate the shoulders, which is why we want to release it. Now warning, this may be very tender, yes, more tender than the other areas, mainly because it is deeper in the body. Now the first thing we want to do is locate this muscle. This muscle is actually located on the inside of the scapula, so in order to hit it, we have to first reach our arm all the way out to help bring that scapula out. And then from here, you're gonna take your other arm and then reach in and basically dig into your armpit and hit that tender area. And you can actually feel it if you're on this muscle by simply rotating the arm. You'll feel that muscle like contract and relax basically. And that's how you know you're on the right area. Now there are 3 techniques we can do here, with the first one being static pressure. Again, apply static pressure to that tender area for only 30 seconds. From here, you're gonna move on to micro movement. Now you know how to do micro movements by now, and what we're gonna do here is we're gonna do this for a total of 1 minute. I'm sure this probably feels a little easier than just simply pressing on it for a minute flat. So 30 seconds of static pressure, 1 minute of micro movement, and then it takes us to the last 30 seconds, which is a pin and stretch. Grab that muscle or pin it as hard as you can, and then simply externally rotate that shoulder and that will allow it to stretch out. Do that for the last 30 seconds. And that is it for part 1 of this treatment. Part 2 is going to come out in a few weeks, where I'm going to teach you how to stretch all these different muscles and perform mobility drills to help realign your posture. If you're wondering why I'm not including the rest of this treatment in this video, it's because A, yes, this does help me create more videos for my YouTube channel, but B, it also allows you to go through this treatment a few times before moving on. Trust me when I say you're gonna wanna do this several times before the next therapies. And the reason why is because if you don't, those next therapies may not feel as effective as they should be. That's it for this video. My name's Adam and this is Pain to Strength, where we believe if you can fix your posture, you can fix your pain. I'll see you later.